Hello, my name is Jenna Williamson, and today I will be covering enterotoxemia in the ruminant animal. Enterotoxemia, which is also known as overeating or pulpy kidney disease, is a condition caused by Clostridium perfringens type D. These bacteria are normally found in the soil and as a part of the normal microbiome in the gastrointestinal tract of many species. So we don't only see this in the ruminants, but we also have seen this type of bacteria in humans and other species of animals as well. So under specific conditions, these bacteria can rapidly reproduce in the animal's intestines, and that causes a large quantities of epsilon toxins to be produced. And this toxin is very significant in producing the disease enterotoxemia. So young animals are the most susceptible, and you can usually see sudden and high mortality rates. Although adult animals are susceptible, they usually develop immunity due to like frequent exposure to low doses of these toxins. So once you get into the older age, you don't see this disease as much. So there are a few factors associated with the enterotoxemia disease. So if you are overfeeding, excessive consumption of milk or feed with high concentrations of grain can cause the animal to get sick. If motility of the gastrointestinal tract is reduced in general, that can also have associated factors with enterotoxemia. When the food ration is rich in carbohydrates and low in roughage, you can disrupt the GI tract, and that can cause enterotoxemia. Or just when natural immunity is compromised, if an animal is sick or trying to recover and stressed out, they can be sick from other GI parasites such as tapeworms and coccidia. Those types of things are associated with the disease of enterotoxemia. So enterotoxemia is most frequent in the younger animals. Studies have shown that it's characterized by sudden death that occurs approximately 12 hours after the first signs of the disease. However, I've worked with some newborn dairy goats that showed signs and then within 2 to 3 hours had sudden death. So this disease can occur very rapidly. There also can be neurological symptoms. It's not a dominant feature of the disease, but you may see some excitement or convulsions, and some other typical signs can be loss of appetite, abdominal discomfort, diarrhea, frothing by the mouth, blindness, and laying on their side. So diagnosis is based on the clinical signs and history of sudden death and confirmation by necropsy examination. So diagnosis can be confirmed by an anaerobic culture, an identification of Clostridium type D from the feces or the intestinal contents. The presence of hyperglycemia can strongly suggest enterotoxemia in live or dead animals, so necropsy data is important for the diagnosis. Here we see a picture, and you're looking at the heart of a lamb with Clostridium type D enterotoxemia, and the pericardial sac has been opened, and there is a large amount of pericardial fluid and presence of fibrin strands. So this can be a good sign and just diagnosis that this animal died from enterotoxemia. So preventative measures are very important for this disease. So if you do think that your animal has enterotoxemia, if they are showing these signs, there is Clostridium perfringens C&D antitoxin, and you use it according to the manufacturer's recommendations. You put it sub-Q. It should keep your animal alive. You can also do antibiotics like penicillin. There's some other antacids and anti-bloating and pain reduction medications that can help. Vitamin B1 can help prevent or treat the neurological signs, but it won't necessarily save your animal. There's some probiotics after antibiotic therapy that can help restore the microflora in the GI tract, but all of this has to be very preventative. Once this animal has enterotoxemia, it's hard to prevent them from reaching that sudden death phase unless they're an older adult animal. So for the younger animals, you should be vaccinating at 4 weeks and again a month later. These vaccines are commercially available to prevent enterotoxemia in the ruminant animals, and you need to vaccinate all your animals in your herd so you reduce the chances that the animals will develop the disease. Make sure you're doing manufacturer's recommendations for the vaccines, and there are some other studies that show an epsilon toxoid that's been produced can be adequate for immunization. So if you can get this from your vet, that's also a good idea to keep on your shelf. And if you combine vaccines against enterotoxemia with tetanus toxoids, just make sure you have them stored properly, not expired. And if you're consistently vaccinating, and if you're vaccinating your bucks, like vaccinate them at least once per year, but do not vaccinate animals that appear ill, and keep good vaccination records for your future references. But one of the main preventive measures is going to be do not overfeed. You have to make sure that they aren't having excessive consumption of milk or feed with the high concentrations of grain, because I have seen that personally on our dairy farm. Our goats, it's overeating that new milk they're just getting to try out.